Today I'm going to be discussing a successful evidence-based program reducing motor vehicle accidents in teen drivers. An evidence-based program is defined as the integration of the best research evidence with clinical expertise and patient values. Some well-known evidence-based programs implemented throughout the U.S. include smoking cessation efforts, youth-oriented drug-free school programs, and the Graduated Driver's Licensing, or GDL program, which will be the focus of this presentation. The Graduated Driver's Licensing program fits all criteria for being considered an evidence-based program, as it has been thoroughly researched and proven to show success. The first of these GDL laws were introduced in 1996. The program consists of 4 core functions, which are holding a learner's permit, passenger limits, nighttime curfew, and supervised practice driving hours. All GDL programs are designed to implement all or some of the 4 core functions to teen drivers aging from 15 to 18. Once the teen has reached the allotted time for the core functions, they are then granted a full driver's license. The objective of this program is to not only reduce motor vehicle accidents in teens, but also to reduce the number of accident-related fatalities. Though the laws vary between states, some requiring more or fewer hours for each of the categories, all states in the U.S. have parts or all of the GDL program implemented as of 2010. An example of this program was demonstrated by Caffarni et al. In Massachusetts, who found a decrease in both injury and fatalities among teens after the GDL program was established. This presentation is designed to examine the GDL program in detail, including how and why this program was created and in what ways it is implemented. The research will answer the questions of why this program is successful and if there are lasting effects, and if this program can be adjusted to be more successful or implemented globally. The target audience of this program encompasses teens ages 15 to 18, as teens are more likely to be involved in a motor vehicle accident than adults. Supervising teens in their quest to obtain a license allows for reduction in accidents, which not only affects teens, but also mitigates the effects on innocent bystanders who may be involved in the crash, or family members who succumb to injury or loss of a loved one. It is clear that one of the determinants of living a healthy life would be to avoid crashes in order to prevent death or long-term complications of accident-related injuries. An obvious example of a social factor that would impact the effectiveness of this program would be education. As any teen in the U.S. who wants to drive legally must follow their state laws for GDLs, everyone must be comprehensively educated on the steps needed to obtain full licensure. This could be accomplished through a formal driver's education program, informal education through a peer group, or through communication from insurance companies. Local law enforcement must also be involved to regulate GDL programs. They must be aware of all aspects required in their location so infractions can be dealt with for those who do not follow rules. There must also be social education throughout the program. Teens can be taught by their parents or driving professionals about rules of the road and what makes for a good driver. If being taught by a professional, the teen driver is more likely to follow the rules of the road. However, if the teen is taught by a parent who may have a more risky driving behavior, the teen may also drive in that way, which could lead to accident or injury. This program also requires work from a parent or guardian. This person must be willing to also enforce the laws and educate the teen on driving. If this person is non-compliant, the effectiveness of the GDL program is at risk. This program encompasses all teens throughout the U.S. It does not discriminate between race, gender, social economic class, or citizenship status. The program is diverse in that each state requires different aspects of the GDL system. For example, in upstate New York, the minimum age to obtain a learner's permit is 16. Nighttime driving restriction is from 9 p.m. to 5 a.m., and 50 hours of supervised driving is required. In Massachusetts, however, teens are required to take driver's education, hold their permit for 6 months, have 40 hours of supervised driving, and a nighttime restriction from 12:30 a.m. to 5 a.m. By requiring teens to hold their permit for 6 months or more, this program allows for teens to learn how to drive for a substantial amount of time. It also accounts for distractions by including a passenger restriction and accounts for the dangers of driving at night. The variation between states may be due to the population, as in how late people work, or the number of people on the road at any given time. As said before, this program protects teens. It protects the community, and it also protects the environment or property that could be damaged due to any accidents. On the other hand, this program is not consistent in all states. Some states require more or less, and many states require that the strictest GDL laws should be implemented in order to have the largest effect on teen accident reduction. The laxity of some programs may account for more accidents. Additionally, parents, teens, law enforcement must all be compliant with the program in order to assure the greatest success. If one of these pieces is off, the teen may not benefit as much as possible and therefore lead to an accident or injury. One of the first mentions of the GDLs occurred in the U.S. in the 1970s by the National Highway Traffic Safety Administration. Known as the Young Driver's Pardon, it stated that experienced in developing driving skills minimize collisions. Though this program did not take hold officially in the U.S. for a number of years, individual versions of the GDL program were adopted in Canada in the 1970s and in New Zealand and Australia in 1987. It was noted that the U.S. was interested in the success of these programs and was concerned about the evidence-based research underpinning it. Per Simpson et al., these actions in Canada and in New Zealand were used to promote GDL to legislation in the U.S. Around early 1990, GDL programs in Canada were being sponsored for by agencies like the Traffic Injury Research Foundation, governmental personnel, and the public itself. While Simpson et al. States that a variety of agencies took responsibility for the enactment of GDLs in Canada, they report it is most likely a combination of many people who were responsible. Once the success of these programs were documented, the Insurance Institute for Highway Safety partnered with the Traffic Injury Research Foundation in Canada and created a report called Graduated Licensing, a Blueprint for North America. This document and the IIHS are the key players in who adopted the GDL program in the U.S. and who performed the research regarding the success of the system. Of note, this document can still be found on the IIHS website and is updated with the most recent information for each state. After this document, states throughout the U.S. adopted the GDLs, and as of 2010, all states had GDL in place. It is clear that the additional countries had an influence on whether the U.S. would adopt GDL practices. Furthermore, the IIHS played an important role in facilitating with legislation to put GDL laws into place. In particular, in Massachusetts, the first legislative order was in 1998 and updated again in 2006. Contrary to this, in 2003, upstate New York implemented their portion of the GDL system. Of course, as those most directly impacted by the program are the teenagers themselves. They are arguably the most important stakeholders. Without the compliance of the teens, its success would be in jeopardy. In addition, parents play a vital role in the program's efficacy by providing the teen with assistance during the GDL program and by enforcing the elements that are required. Furthermore, the Institute for Highway Safety is another stakeholder in this program, as their primary stated focus is reducing motor vehicle crashes and injuries. They are a non-profit organization that is funded by auto insurance companies, yet another stakeholder in this program. Auto insurance is used during vehicle crashes in order to cover damages, but their issuing company's primary hope is for an accident to never occur. Local law enforcement agencies are also stakeholders in that they are responsible for enforcing this program. Lastly, healthcare professionals and care providers are additional stakeholders. They are the ones to respond first and provide vital care for individuals involved in accidents. And if the number of accidents for teens could be reduced, it would mitigate the number of visits to the emergency room, thereby cutting national healthcare costs. While information regarding specific funding of these programs in each state is not readily available, it is documented that there is no national law. Therefore, there is no federal funding for GDL programs. Based on the fact that each state is allowed to implement the severity and components of the GDL system, funding for this program would be determined on a state-by-state basis. Also, because these are laws that are enforced by the law enforcement in each state, the state would also have responsibility in funding the program. Additionally, due to the large involvement by the IIHS, one may believe they have a part in funding for the GDL as they support it and continue to research on its success. In order to keep this program running for continued funding, it is known that the teenager is also required to pay for such things as driver's education, issuing of the permit, and issuing of the driver's license itself. In order to take the burden off of the states, and due to the large success of this program, it would be logical for a federal policy to be put into place so this program can become federally funded. Due to the conception of this program being evidence-based, there are clearly accompanying ethical concerns. For instance, some have argued that evidence has been fabricated or presented in such a way to produce shock value in order to gain legislative approval for the policy. While one cannot argue that this program has generally reduced accidents, legislators may argue the extent to which the policy has been effective, or allege that data arguing for the harshest restrictions may be exaggerated. Others may also argue that a meta-analysis of the existing research must be conducted to make large assumptions and conclusions. In addition, policymakers themselves might not be particularly interested in original research itself, but they might be more invested in garnering electoral support. As a result, the teen may not be the most important piece of the policy. Another ethical concern in the development of the program is that the difference between each state must be accounted for. Each state requires different versions of GDL laws, therefore one may be stricter than the next. It could be argued that this is an ethical concern due to the fact that one state may be comparatively lax, thereby resulting in compromised prevention for teen motor vehicle accidents and injuries. As a result of this program's resounding success, it would be challenging to oppose the program in its entirety. None could argue that this program harms teens. However, some, including the teams themselves, might also oppose certain aspects of the core functions of this program. For example, the learner's permit period could be considered too lengthy, the passenger restriction ineffective, or the nighttime driving curfew too strict. Additionally, the teen may also oppose driver's education, and some parents may oppose having to attend a driving class themselves. As teens are far more likely to be involved in motor vehicle crashes with resulting injury or fatality, this program is profoundly needed. This alone is enough for the citizens to want to make changes for the sake of the teen, parent, family member, and the community. Social factors that contribute to the need for this program include family and education. Family members would support this program in order to protect their loved ones. Those in favor of the GDL felt that teens and parents needed to be educated on the need for this program. Educators could then show the results from the initial GDL laws in place in New Zealand and Australia and promote why the U.S. also needed this program. Educators and insurance companies marketed the programs using statistics on teen injury from motor vehicle accidents in order to convince family members. Insurance companies also gave incentives for those who participated in GDL by providing reduced insurance rates. The IIHS also developed a GDL calculator, which allows a person to search each state, show the GDL requirements, and categorize them as good, fair, marginal, or poor. As motor vehicle crashes cost the affected individual and the local healthcare systems an astronomical sum, the GDL program boasts economic benefit as well. According to the CDC, an emergency room encounter costs around $3,000 for a crash-related injury. For those who have lifetime injuries secondary to a motor vehicle crash, it is estimated that the care for costs accrued over a lifetime average $18 billion. For those who do not have insurance, this cost is a debt some may face for life. In terms of political factors that contributed to the need for this program, legislative powers supported this prior to initiation. The government's role in public health is to promote safety and ensure that the community as a whole is healthy. With such high rates of teen crashes, combined with the demonstrated success of these programs in other countries, the government must have felt pressure in order to protect the community, making the GDL program a necessity. Also, if many states implemented this program and a handful did not, lobbying for this program would have erupted by the community and those in favor. Therefore, all states have enforced these laws for quite some time now. In order to convince others of the proposed program's merit, I would begin by highlighting the rates of teen motor vehicle accidents and the major statistics revealing the human loss prior to GDL's implementation. Providing this information would effectively shock the audience and would especially gain the attention of the target audience in particular. In addition, I would demonstrate which communities have these laws in place and demonstrate the extent of their effectiveness. Moreover, to market this program specifically to parents or guardians, it would be beneficial to show the potential reduction in insurance rates if one proceeds with driver's education or other guidelines of the GDL program. Furthermore, I would approach the community at large by focusing on the strictest GDL programs to discuss any potential annoyance, such as impatience with the length of the time one may be required to hold a permit. These potential negative outcomes could then be contrasted with the demonstrated benefits of the program. The GDL program was successful because it reduced the number of motor vehicle accidents in novice teen drivers in every state and county in which it was implemented. While the research presented to legislative powers was solely based on evidence, the effects of this program outweighed the risks. In regards to the community, this program is also successful for the same reasons, namely that it reduced motor vehicle accidents and fatalities. It is also successful in that each state in the U.S. has some aspect of this program in place, which makes for a somewhat uniform law. Considering that GDL is a widely new program, with all states having instituted parts of it in 2010, data regarding its long-term effects is sparsely available. One study by Caffarani et al. Demonstrated that in Massachusetts there was a long-term effect which lasted at least 5 years since the introduction of the program. If the program was to be implemented federally with the harshest standards for all core functions, many research believe that the teen crash rate would continue to decline, as it is still high compared to adults. However, this might require teens to wait longer to receive their license, which could present an annoyance to both the teen and parent. In the future, if the program is subject to all novice drivers, regardless of age, it may have an even greater impact on crash rates, but also may be an annoyance for an older person. Overall, however, the quality of life for the entire community, including the teen, parent, or bystander who could be involved in an accident with the teen, has done nothing but increase since the onset of the program. Not only does the U.S. implement these laws, but other countries around the world do, as mentioned, New Zealand and Australia. I can only see the positive impact this program has had throughout the world and cannot see why this program would be opposed elsewhere. Research shows that in Namibia has one of the highest rates of car crashes and may therefore benefit from implementation of the GDL system. While they have some level of driving regulation, they only require 25 hours of practice prior to obtaining a license. However, one must consider that around half of the population lives on $1 per day. Of course, this challenges the program's implementation, as a teen may not be able to afford the training required, and the government may not be willing to invest funds into this program. Ideally, it would be beneficial for the community if all countries followed GDL programs from a community aspect, financial aspect, and overall global public health. Thank you.